Dear viewers, ladies and gentlemen, for those of you who don't speak Arabic, welcome to the press conference again, which is becoming every second week now. And as usual, I would start with numbers internationally, then locally. Up till this morning, 44,252,637 confirmed cases of COVID-19 worldwide been registered, and the total number is 1,173,106 deaths worldwide. In Oman, yesterday we had 618 confirmed cases, which takes our total to 114,438 cases. Those who recovered so far is 103,060 cases, which is almost 90% of the cases. Admitted to our healthcare facilities yesterday, 57 patients with COVID-19. The total in our hospital beds as of this morning, 447 patients. 10 admissions yesterday to the intensive care units in the country, and the total number of patients in our intensive care units, 185 patients. That number is still very, very high. Those who died yesterday, 5 persons, and the total number for those who passed away is 1,208. As you could see, and as you've been following worldwide, unfortunately, the virus is still spreading very fast. WHO announced a couple of days ago it was the highest cases in one day, over 450,000 cases worldwide in one day. Unfortunately, there are still those worldwide who don't believe that this virus exists. And some of those who know and they believe it exists, they don't believe how serious it can be. I think, let me talk about Oman. I don't think any of us doesn't know a family who has not lost a beloved one to this virus. I've mentioned a few weeks ago, we had 222 patients in our intensive care units. And I would like to remind everybody that the survival for those who are in the intensive care units, in the best units, does not exceed 75 to 80%. So when you end up in the intensive care unit, or your beloved one, doesn't matter how old you are, doesn't matter whether you've had chronic diseases before or not. We've seen, unfortunately, young individuals dying from this disease without prior medical conditions, despite all the excellent health care they received. And here I have to register my thanks and gratitude to all those working in the healthcare sector and other sectors that are supporting us. They've been working around the clock since the beginning of this pandemic. And I've mentioned in Arabic, some of them, they have not taken one day off since the beginning. And the only way to save our healthcare system, the only way to reduce the pressure and the load on us, is by reducing the number of cases. And we all know how to do that. I don't think any of us doesn't know how to do that. Wearing the mask properly, and the appropriate mask as well. I was told that there are masks sold in the market now, and it's clearly written on them. They are not suitable to prevent infection. So please, when you buy a mask, make sure that it is approved, firstly. Secondly, wear it properly. I've seen so many who are wearing the mask covering half the mouth only, and the nose is opened. If you sneeze, if you cough, or if somebody is carrying the virus next to you, it can go through your eyes, through your nose, or through your mouth. So please wear it properly. Hand hygiene. One of my colleagues sent me just about an hour ago. He did a survey on the Twitter about hand hygiene, and it is shocking that only 30% adhering to that simple procedure, knowing that our culture, our religion, and all religions asking people to be clean. And the first thing to clean are your hands, keeping your physical distance. avoiding crowded places. All these are doable and possible. No country, no group of responsible individuals would like to go back to lockdown, whether it is partial or total. Definitely not. We had to do that 4 weeks ago, and there were some excellent results. And the result, we had reduction in the number of cases in the ICU, reduction in the admission rate. Why do we need to resort to such actions to deprive the majority of people who are adhering to the healthy procedures from their workplaces, from going to have something to eat, from meeting their immediate family members, because of those who do not, unfortunately, follow the rules? So we don't need to go back to lockdown. We don't need to go back to any more than what we can do without that, i.e., keeping our physical distance and what I've mentioned before. We don't, unfortunately, at the moment, we cannot provide lots of medical healthcare programs which were running smoothly. We have to put them on hold to care for COVID patients. There are so many operations which have been delayed. People have been deprived of going to see their doctors in the hospitals because these doctors now dedicating their time to look after corona patients. Some of our primary healthcare programs, which we are very proud of, have also been put on hold because we need the staff to go and help their colleagues in the hospitals. The consequence of this in the long term is going to be very detrimental on our healthcare system and on the health of the population. And again, we can make things better together. His Excellency Dr. Abdullah Al-Ambu Saeed, the Undersecretary of the Ministry of Education, gave a report or briefing about the opening of schools next week. And it's very clear that the priority of His Majesty's government, all sector, is the health and well-being of everybody in this country, whether they attend private schools, whether they attend the government schools. And they've done an excellent job. And here I have to register my thanks and appreciation to Her Excellency, the Minister of Education, and her team, with the team from the Ministry of Health who've been working around the clock to make sure that schools and colleges are safe to practice education. And again, there is no easy option. There is no right or wrong. We've seen countries which started school before us and they've had to change the way they were doing things. And we are very flexible here as well. It all depends on this virus. And let me say, actually, it all depends on us. The virus can only spread if we allow it to do so. So the private schools, the international schools, and the government schools, all of them been informed by the team from the Ministry of Education about all the procedures they have to follow. There is a joint team between the Ministry of Health and the Ministry of Education to make sure that these practices are adhered to. I've mentioned in Arabic about the vaccines, and the good news, there are many companies which are at the final stages of the clinical trials. There are more than 10 now, and there are other companies, over 100 plus, who are in different phases of the clinical trials. But even if, as it looks now, 3 or 4 companies might submit their results for the regulatory authorities in their countries, that will take some time. We've booked, we are members of what's called COVAX, which is organized by WHO and Gavi and other organizations, and we've booked between the COVAX and private companies over 1,830,000 doses. And I need to mention here that each individual will require 2 doses of the vaccine. That's stage 1. And for stage 2, we booked also 1,800,000. But I have to be very clear and frank, we do not know when we will get the first shipment of these vaccines. It depends on their safety and the registration in the country of origin. But we are negotiating with all the companies who are in the lead in the production of vaccines. But even when the vaccines arrived, and even if they are when we prove that they are safe and effective, no country will be able to vaccinate everybody. There are priorities which are put for all countries, of course, with the help from WHO. So just trying to remind you that the best vaccine is for you to follow the regulation, the practices that we've mentioned several times, to protect yourself, to protect your family, to protect your community. The vaccines, of course, as I said, are from so many different countries, and I'm grateful to the ambassadors of countries that are producing vaccines that I've met, and I'm in the process of meeting others, in addition to the personal contact, for offering their support and help for us to acquire the vaccines when they are available. My last word, again, the question is, and here for the younger population, this idea that I'm young, I'm fit and healthy, and I don't care if I get the virus, I'm sorry to disappoint you, but that's not true. We've had, as I've mentioned before, the youngest person died in Oman, 15 years old. I know that the weather is getting better, it's getting nice, and I know many of you are planning trips to the desert or the beaches are closed. I can tell you gathering is not allowed, whether you are on the beach, wadi, or desert. But please remember that your health is more important than anything else at the moment. And even if you, with your immediate family, 5 or 6, decide to get together, try to keep your physical distance. You don't know where your brother has been in his, whether at the shopping mall or with his friends somewhere, if he's carrying the virus. The unfortunate thing about this virus, that you could be a carrier without any symptoms. And you could pass the virus even if you are asymptomatic. If you don't have symptoms, you can still pass this virus to your family, to your colleagues at workplace, to your friends. So what I'm asking all of you and urging all of you to please help us to reduce the number of cases so that our healthcare system will continue to be able to provide the services that we all need. That's secondary gain, though. The first and the most important gain is to keep yourself healthy and protect your family. Even if you have the virus and you have it mildly, you might pass it to somebody who will end up in a hospital, in an intensive care unit, and unfortunately might end up dead. So it's all in our hands. I don't think anybody could blame any side. We are all in it together. And to go through this pandemic with minimum damage and loss, we need to be together, and we need to work together, and we need to help each other. So thank you very much for listening, and hopefully we'll see you in a couple of weeks' time.